root cause of the problem is the fact that they have undiagnosed ADHD. Today, I'm going to be talking about the difference between the symptoms of anxiety and ADHD and how they are often misdiagnosed. The conversation, usually organically starts where they'll say, well, I was diagnosed with anxiety, but I've been taking all of these medications and I've been in therapy and so on and so forth, but I feel like there's something else going on. And I have seen it several times, time and time and time again, where somebody is diagnosed with anxiety when what the root cause of the problem is the fact that they have undiagnosed ADHD. So the way this happens is, patient will come in and they'll describe the symptoms that they're having. And a lot of those symptoms are most closely correlated to anxiety: racing thoughts, not being able to sit still, forgetting things, not liking to be in social situations, never really feeling comfortable, never really feeling sure about themselves, worrying about things that might happen, things that might not happen, things that already happened, things they said, how they said it, and just kind of just over worrying and getting themselves overwhelmed about things. And then when you dig a little deeper, I start to find that my patients with ADHD, that anxiety is usually directly connected to something that is rooted in their ADHD. So let me give some examples. So you have someone who has ADHD. They're working and at their job, they're realizing that they're forgetting a lot of things, they're making a lot of mistakes, they're being reprimanded at work. They might be on an improvement plan at work where they're realizing that, like, okay, this is becoming a pattern. You're constantly forgetting things, you're handing in reports, and they've got, mistakes on it and things of that nature. Now that person starts to become anxious. So they start to become anxious to go to work. So now in the morning, they wake up, they know they have to go to work. This is going to be another day where I'm going to try to cross all my T's and dot all my I's. But then I'm afraid when I hand in this report, are they going to hand it back to me and they're going to show me all of these mistakes? And then I'm going to be on edge, right? So that anxiety builds now, right? So then there becomes like almost like a social anxiety. Okay, I'm at work. I feel like everybody's looking at me because like they know that I'm not doing well, and I'm on a support plan, and I'm the one who messed up the last presentation. And so now they become self-conscious and anxious in public. So now they feel like they have social anxiety, when really what it is the root cause of everything is because they can't focus, they can't concentrate, they can't initiate, they can't organize, right? Which are all encompassing of a diagnosis of ADHD. It is now causing anxieties about all of that. So anytime a project is due, they're anxious about it. They're always thinking that they forgot something. Even when they're done with a project, when they're done with an assignment, when they're done with something, they still have that underlying anxiety. Is it really done? Did I do everything? Did I finish everything? Not to mention, then they are easily distracted. So these aren't projects that they're just focusing on for hours. They're getting distracted because they're thinking about this. Well, did I remember this? Did I remember to lock the door? Did I remember to do this? And then the racing thoughts just they keep going on. Not to mention how some people with ADHD communicate. And I see this a lot in interpersonal relationships. Parents and children, spouses, friends, roommates. You have the person who has ADHD who, even in conversation with someone, they are so anxious about the fact that they might forget what they want to say that they just cut the person off who they're talking to. Who likes being cut off when they're in the middle of a sentence? Nobody. So that's not going to be the person that people want to talk to all the time. It's like you can never get in a word edgewise with that person because they're just gonna cut you off. Anytime you start a sentence, they're just gonna cut you off. It doesn't even matter. They don't really care what you have to say. It's not that that person doesn't care what the other people have to say. They just are so pressured and thinking that they're going to forget what they want to say and that they want to respond to whoever they're communicating with, that they just jump in and give that answer right away. Or they're so internally preoccupied with their own racing thoughts and so on and so forth that they're having a conversation with someone, but they didn't hear anything that that person said. So now when it's their time to respond, if they even recognize that it's their time to respond, it's like, hello, anybody in there? Like, did you hear what I said? And then they're like, oh, And then that's embarrassing for a person, depending on, where they are and who they're with. And it can be frustrating if it's a spouse. You never listen to anything I say. I just said that. We just had that conversation. Yes, I did. I told you. I told you my mom was coming over. I told you you needed to pick her up from the airport. No, I didn't. I didn't even. So those are the different situations and frustrations that people come in, and it's like, yeah, well, I'm anxious. I'm anxious to go home to my wife. I'm anxious to go home to my husband, because then we're always arguing. We're always fighting because they don't feel that I validate their feelings. They don't feel that I listen to them. They don't feel like I'm communicating. They don't feel like I care about, what they're saying. And it boils down to ADHD. Understanding what it's like to walk in a person who has a neurodevelopmental disorder, walking in their shoes and experiencing the world the way they experience the world. The other conversation that I'll have often with patients, and they'll say, well, I've been like this for so long, I've done well, I have a good career, and so on and so forth. Sometimes I feel like, whether I know I have a diagnosis or not, like, what's that going to change? And often what I find is, in conversation with those people, although on the outside, they seem to be performing at the same level as their counterparts, the amount of energy that they're having to put into the things that they're doing to be at the same level is so much more. So I almost imagine it like when you go out, you go to the park or you go to the mall. Do people go to the mall anymore? You people go out and you're doing things and you see like a father and he's holding his daughter's hand or his son's hand. And they're 2, 3 years old. They have little feet. And dad has big feet. So dad's stride is much larger and much bigger than son or daughter's stride. So son or daughter has to take 3, 4, 5 steps for dad's every one step. So that's how I compare it to when you have someone who has ADHD. They have to take 5, 6, 7 steps for that one stride that everybody else has to take. So they're exerting a lot more energy in order to, they have a lot of, I've met patients who have so many different checks and balances to be able to maintain their jobs as nurses, as doctors, as teachers, as educators, as police officers. They have a lot of checks and balances that they're constantly checking off because they know, they're aware of themselves. It's not that they're not aware of it. They know that I'm constantly forget. I'm not going to remember this. This isn't going to be done in an order. So they create a lot of different systems. And then they have an underlying anxiety because it takes a lot of work to maintain all of these systems. And then they're always worried about, did I check off all the boxes for all of the systems that I've created for myself just to be able to maintain a balance and to be successful, so to speak, in whatever arena that they're in, whether that's at home, whether that's at school, whatever. It just takes a lot more energy out of them. So that's why, as a provider, I really have had to hone my skills in knowing the right questions to ask. Because a lot of times it's not that patients don't want to share information. They don't know what information to share with you other than, I can't focus and I can't concentrate. So even sometimes comparing, what is your ADHD like when you're at work versus when you're at home? Do you find that you forget things at home much more than you forget things at work? Patients often have been misdiagnosed. Well, they can't have ADHD. They do so well at work. Yeah, but then the rest of their life is in complete shambles. Sometimes the pressure, there's a lot of people who just work better under pressure. You know that deadline. A lot of people with ADHD, they only work well under pressure when they have a deadline. When you're at home, you don't have deadline to do the laundry. But when you don't do it for 2 and 3 weeks, now you have no clothes to wear. So that pressure at work, you don't want to let people down. You don't want to, you don't want to lose your job. You don't want to, any of those things, that pressure for a lot of people that keeps them, kind of able. But it doesn't mean that they feel good under that pressure all the time. Being under that level of pressure all of the time is overwhelming. And then it causes mental fatigue. So now here we are with one diagnosis, ADHD, that now is causing anxiety, and now it's causing mental fatigue. So now here you are already full circle, and they're just circling this drain of ADHD, anxiety, mental fatigue, ADHD, anxiety, mental fatigue. It's exhausting. It's exhausting. I've tried to really learn to know what questions to ask so that I can get the best information out of my patients so I can differentiate, is this ADHD? Is this anxiety? And often when I'm able to go in and I diagnose ADHD and we start to treat that ADHD, the anxiety, it goes away. They don't have the anxiety anymore. So then that really lets me know, like, yeah, we definitely got it right. The anxiety was really, really rooted in what was going on with the ADHD that was not diagnosed, not managed, not being addressed. And then other things start to fall into place. They're not staying up late, anxious and worrying about what tomorrow is going to be like. Now they're getting a better night's sleep. Now that fatigue that they have during the day, that they were drinking Coca-Cola and Mountain Dew and Celsius and all types of energy drinks and coffee and all these types of things, now they're not doing that as much anymore, right? So now their health is getting better. They're not drinking as much sugar and caffeine, and the caffeine can also play into those feelings of jitteriness and anxiety and not being able to sit still. Overall, I will start to see my patients come in and they're like, oh my gosh, I just feel so much calmer. I can literally have one thought at a time. I can have a conversation with someone where I don't feel rushed. And then it's encouraging for them because people around them start to notice. It doesn't take very long. Usually within 4 weeks of treatment, for most of my patients that I diagnose properly with ADHD, within 4 weeks of treatment, family members, wives, husbands, children, they're noticing it different. Best friends, bosses, teammates, they're starting to notice a difference in the way they communicate and just how relaxed they are, decreased irritability. That's really when we know, like, yeah, we definitely hit the nail on the head. So now that we've touched upon proper diagnosis when it comes to ADHD and kind of what that looks like and how that can be misinterpreted for symptoms of generalized anxiety, I want to touch more on anxiety. So I am very excited about the fact that now the time that we're in, we're starting to really educate ourselves about mental health, and we're all starting to have common language and understanding about things like anxiety and depression and bipolar disorder and OCD and things of that nature. But I often have to educate and even remind my patients when it comes to anxiety, we often end up using the same word to explain every single emotion. So what I mean by that is I will get patients who say, oh, well, I have anxiety. And I'll dig a little deeper and I'll say, okay, well, are you the type of person who something happens, you get anxious about it, but then once that situation has resolved itself, are you back to your baseline? And they'll be like, yep, that's me. I worry about everything. But then once it's done, like, I can calm down. And what I try to explain to those people is like, I think what's going on is you have more of anticipatory anxiety, so to speak. You're anticipating something. It's the unknown. Oh my God, I get college students or I get high school students like, I know I have to go to college. I haven't gotten in. So yeah, that feeling of anxiety may last for a couple weeks or a couple months surrounding one particular situation or event. You have a wedding coming up. You have a big speech coming up. You don't like to fly and you have to fly overseas. You have to be on a plane for 10, 12 hours, right? Like you're anticipating the fact that you're going to be in a situation that you don't have all the answers to. You're not totally in control and you're feeling anxious about it. So anxiety is a normal human emotion, being anxious about the unknown. Like that's why that exists. We don't have all the answers to things and it makes us uncomfortable. And that's where we get that kind of anxious feeling from. That is very different from the person who doesn't have any, any environmental triggers of anxiety, but they are just anxious about nothing. There's nothing that they're anticipating. Nothing's coming up. Nothing's going on. They're just worrying about everything. Am I going to get to work on time? Okay, it's 8 o'clock. I got to get to work. By 9 o'clock, am I going to get to work on time? there's nothing that really exists for them to worry about why they're not going to make it on work on time. You have a car, there's gas in the car, you're already up, you're already dressed. There's no reason for you not to make it to work on time. But this is a person who is overly anxious now. They have now created a situation. Often patients with generalized anxiety disorder will create a situation to be anxious about when there really isn't a situation that exists at all. Many people are fully aware of that point, which is what makes them that much more anxious. It's like, all right, well, what else am I going to make myself anxious about? So again, I've had to get really clever and kind of really good at knowing what questions to ask when it comes to generalized anxiety. So I, myself, and the patient can figure out, all right, do you have, anticipatory anxiety? You're anxious about something that's about to happen, something that's going on, something that you're, uncomfortable about, and that's why you're worrying about it. But then once that situation has subsided and it's resolved, you can kind of take a deep breath. Whereas my people with generalized anxiety, even if they get even more anxious because they're anticipating something, so their baseline is already, they're anxious about everything. Something is happening, a wedding, a trip, or what have you, they get even more anxious because now they're adding on that anticipatory anxiety. But then even once that's done, like I said, their baseline is anxious. They're going to create something else to be anxious about, or just be anxious and they have no idea why they're anxious. They're just anxious. They just have that underlying rumble of just feeling uneasy, can't relax, can't really take, a full deep breath. Even when they lay down, these are often patients that I find they deal with issues with insomnia a lot, because once they lay down and they're in a room by themselves and the lights are off and the phone is down and everything is quiet, now the thoughts that are in their mind are racing, and making them that much more anxious, to the point where now 12 midnight, 1 a.m., 2 a.m., until the body is probably so exhausted that they finally fall asleep, but then not for very long, and then they're back up again. So then imagine how much more anxious that person is when they're not getting any sleep, night after night, week after week, month after month. It starts to roll into some other symptoms, right? Insomnia. That person's going to have decreased stress tolerance and increased irritability. Everything gets on their nerves. They can't wait for the bus. They can't wait for, in the line at the grocery store. They can't wait, for the elevator. They're just too anxious to wait for anything. They just got to go. They just got to move. They just got to do something. They can't sit down. They just have to. That's the way that they feel that they can expel some of that nervous energy. I get a lot of patients who will say, like, yeah, I feel like I'm always using a lot of nervous energy. And after hearing that a lot from my patients, I've started to just ask patients who may not even bring it up, do you feel like you use a lot of nervous energy? Yeah. And they'll be like, yeah, exactly. That's exactly, yes, I do. Like, yeah. And I'm like, okay, kind of trying to put myself in the shoes of patients who are experiencing anxiety or whatever the diagnosis may be, and just learning to ask the right questions. So remember the differences between ADHD and anxiety. Anxiety may not necessarily be ADHD. ADHD may not necessarily be anxiety. And then, of course, to keep things interesting, there are people who end up having both. And that's for another day for us to get into. But if you feel like you're experiencing these types of symptoms, you should definitely talk to a mental health professional so that you can kind of get to the bottom of really what's going on and get the help that you deserve.